What is a hypothesis? A hypothesis is like a prediction. It's what you expect to happen in your research. Think of it as an educated guess. In nursing research, a hypothesis is a statement about the relationship between two or more things that we can study. For example, you might want to study if there is a relationship between hand washing and hospital-acquired infections. Your hypothesis might be, increased hand washing by nurses will reduce hospital-acquired infections. This statement predicts a relationship between hand washing and infection rates. Now, you need to test this hypothesis through your research. There are different types of hypotheses. One type is a directional hypothesis. This type of hypothesis predicts the direction of the relationship. For example, you might say, patients who receive more social support will have lower anxiety levels. This statement predicts not just a relationship, but also that social support will lower anxiety. Another type is a non-directional hypothesis. This type of hypothesis predicts a relationship, but not the direction. For example, you might say, there is a relationship between a patient's age and their recovery time after surgery. This statement predicts a relationship, but it doesn't say if older patients recover faster or slower. In research, we often talk about two main types of hypotheses, the null hypothesis and the research hypothesis. The null hypothesis is like a no-effect statement. It says there is no relationship between the things you are studying. For example, a null hypothesis might be, there is no difference in pain levels between patients who receive medication and those who receive a placebo. This statement says the medication has no effect on pain. The research hypothesis, also called the alternative hypothesis, states the opposite. It says there is a relationship between the things you are studying. For example, a research hypothesis might be, patients who receive the medication will have lower pain levels than those who receive the placebo. Hypotheses are essential for good nursing research. They give your research direction and help you focus on what you want to study. By stating a clear hypothesis, you can design your research to test it properly. Understanding the different types of hypotheses and how to formulate them correctly is crucial for producing meaningful research findings. These findings can then be used to improve patient care and outcomes.